Welcome to this webinar on explaining score differences between PLS-5 and CELF Preschool-3. Let me begin by providing a context for this webinar. Pearson receives a great deal of feedback about these two preschool tests. We hear PLS-5 works great for my population, and we also hear PLS-5 is way too easy for the children I test. For CELF Preschool-3, we hear either CELF Preschool-3 works great for the children I test, or CELF Preschool-3 is way too hard for the children that I test. Clinicians need to consider the different factors that could contribute to the differences between the tests. So though the tests were designed to assess similar skills, several factors will be the focus of our webinar today. Both Patricia and I are employed by Pearson Clinical Assessment, who's the ASHA continuing ed provider for this session. There's no relevant non-financial relationships to disclose. And Pearson Clinical Assessment develops and distributes assessments and intervention tools for SLPs. The presenters will only cover information that pertains to the effective and appropriate use of PLS-5 and CELF Preschool-3. No other assessments will be discussed during this presentation. We also will not be talking about PLS-5 or CELF Preschool-3 administration, scoring, or interpretation procedures. If you're interested in those topics, you can see the webinar recordings posted on pearsonassessments.com. Our agenda for today is do an overview of the PLS-5 and CELF Preschool-3, identifying referral concerns and how that applies to selecting one of the two tests, the data obtained by the two tests, why children might obtain different scores on the two tests, and then we'll have some case studies. At the completion of this webinar, you should be able to list at least two differences between the two tests, explain how referral concerns and a description of the child can help clinicians select the test that provides the most useful information about a child's language skills to diagnose a child and plan treatment, describe at least two differences in the type of data collected with each test, and list two reasons that can contribute to score differences between the two tests. We're going to start by briefly going over the two factors that would make PLS or CELF Preschool more or less useful for a given child. There are factors related to the child you're testing and factors related to the composition of the tests. When making a decision about which test to use, you need some basic information about the child. If you're needing to use a norm reference test, certainly the age of the child applies. If the child is under age 3, you're not able to use CELF Preschool-3. That's not an option. But if you're testing a child who is age 5 and functioning at an emerging verbal level, you should consider administering PLS-5. A child at an emerging state of language development may not be able to get enough of the expressive items correct on CELF Preschool-3 to give you much information for planning. When you're looking at birth and medical history and developmental language levels, look for significant information that would provide you some information about the child's current development as well as language development history. If there were significant birth or medical issues, you may want to start testing with PLS-5. You definitely want to know how verbal the child is, or if the child has other developmental delays or deficits. And ideally, you already have some basic information about the patterns of the child's language abilities. It's also very important to attend to the caregiver or teacher concerns, needs, and preferences. Are the concerns around early development of the child? If so, you'll get more information from PLS about developmental language skills. If concerns are around how the child is doing in a preschool or general education classroom, and the child speaks at least a sentence level, CELF Preschool will drill down to give you much more information about specific skills. You also want to know if the child has been cared for in the home or has had the opportunity to be in a preschool or school. If they've had experience in preschool or early childhood settings, then they may be fine with being able to sit through a CELF Preschool-3 and follow directions and do a lot of test items that are all, similar in format. If they have not been in a situation where they've needed to sit with an unfamiliar examiner outside of a classroom, these children may need additional time to establish rapport and may need additional training tasks or cues to participate in testing. And of course, then a child's primary language is important. Is a child new to the country or to the area, and are the situations depicted in the test situations that a child is familiar with? So the more you know about the child, the more you can plan the sequence of assessment procedures that you need to get a best performance from him or her. So assessment tools have different purposes and different ways of approaching the same construct. When you change the format of a test item, you're changing the difficulty of what the child needs to be doing to be able to perform the test item. Clinicians certainly have strong preferences about which comprehensive assessment tools they use, for example, for school-age children. There's a lot of overlap in tests that look at the same domain. So CELF Preschool-3 and PLS-5 both assess receptive and expressive language, but they're very different in terms of test purpose, the age ranges, and the subtest or subscale item design. And of course, while there is overlap, those differences make a lot of difference in how well a child is able to perform the task and how much information you're obtaining from the test. So factors related to the assessment tools you're considering, both of them are looking at receptive and expressive language, vocabulary concepts, morphology, syntax, pragmatics, and pre-literacy. Both tests address each of those domains, but they do it in rather different ways. And both of them provide the same kinds of scores, although based on different normative samples, now differing by about 10 years apart at least. So let's go over the two tests right now. First, I wanted to provide some background that provides perspective on how PLS and CELF Preschool were developed. The PLS authors included a clinical psychologist, an early childhood educator, and a speech-language pathologist. So this was a collaboration across disciplines. The test was released originally in 1969, but this information is from 79 because that's the copy of the test I have. PLS was developed as a developmental tool to look at maturational lags and strengths and weaknesses in language. And the authors met when they worked with children at a Head Start center. So Violet Steiner was an early childhood specialist who was director of the center. Lee Zimmerman, a clinical psychologist contracted to do cognitive assessments and to consult with teachers. And Roberta Pond was the speech-language pathologist who was a contractor to provide speech and language services. They wanted something short and easy and quick to administer to look at early developing milestones. And that was important for them in their Head Start settings and for Lee Zimmerman, who also provided services in early childhood programs, child developmental centers, and in special ed settings. To contrast that, CELF Preschool-3 was developed by Elizabeth Wigg, Eleanor Semmel, and Wayne Secord, whose expertise was in children with language learning disabilities in school settings. So their initial focus was on school-age children, 5 through 21 for CELF, and that edition was developed in 1986. But in the early 90s, when legislation expanded services for preschoolers, they worked on a downward extension of CELF to produce CELF Preschool-3. And then that was, well, the original CELF Preschool, but that was the beginning of this version of the test. So you can see both tests were developed to meet a need for a comprehensive language assessment or a diagnostic assessment in the preschool range, but the needs they were designed to address were really quite different. PLS has a more developmental milestone focus, and CELF Preschool much more focused on readiness for the classroom, having the language skills they need to perform well in the classroom. So both tests were designed for diagnosis, determining eligibility for services, identifying strengths and weaknesses, having enough information that you would be able to make recommendations for strategies to improve performance and measure treatment efficacy. Let me move on. So then how do you decide which test, though, to use with a young child? PLS was designed to be used with young children who have a receptive or expressive language delay that interferes with communication. So in each subsequent edition, the age range went down all the way to birth because there were children who were being tested who were very severe and who had severe delays and often operated at a very, very young age level. And then the upper age range expanded somewhat because clinicians wanted to be able to continue to follow the child through their early school years, all the way through age 7, 11. CELF Preschool-3 is much more in-depth, so a narrower age range, 3 through 6, 11. So within that narrower age range, you have a lot of test items, looking at semantics, morphology, syntax, and actually pragmatics as well. To be able to take this test, though, children need to be able to speak in complete sentences. On PLS, you can drop back all the way to a very early stage of language development, pre-verbal levels, but you're not able to do that with CELF Preschool-3. So a child has to be able to speak in complete sentences. Their receptive and expressive language skills are examined in a much more structured school-like format than PLS-5. And then if a child can attend and stay with you for the test administration, you can get a lot more in-depth information about each area tested more quickly than you can using the PLS. Now, for children who can't take all that test structure and who respond better to quickly moving from task to task, just a few test items within each task, the more likely you are to get better information from the child using PLS-5. So similar areas are tested, but the format of the test items, it's a different approach. So on PLS, you'll see here, we have, I have the items that are at pre-verbal levels because CELF Preschool doesn't, they're in small text because CELF Preschool doesn't address those areas. But you're looking, even the age ranges where these ages are examined are quite different on the two tests. So on PLS, social communication items are birth to 211 versus the pragmatics profile that are ages 3 to 611. So depending on the age of the child, if the child is 3 years old and above and you want to examine pragmatics in more depth, you're not going to be able to do that on PLS. Vocabulary skills on PLS go up to age 311, expressive vocabulary on CELF Preschool, much more structured task once again, and it's for ages 3 to 611. So again, if you've got a child functioning pretty well within that 3 to 611 age range, CELF Preschool-3 will give you a lot more information than PLS-5 would. Both look at acquisition of basic concepts. Both look at morphology and syntax. Both look at some kind of integrated tasks, like using their understanding of concepts, for example, and sentence structure in the following directions subtest. On PLS-5, you look at skills like object function, making inferences, analogies, putting items into categories for ages 3, 6 to 7. And then on PLS, there are some test items looking at literacy from 5 to 7, 11. On CELF Preschool, those tasks start at age 4. Here's an example of test item where the content and the approach are similar, and that it's a picture identification task, but the stimuli are rather different, and the test items are as well. So on PLS-5, the examiner points to, points to pictures, and either on this particular one names the pictured objects, and they need to get 5 out of 8 correct. And when you look at the difficulty of the pictures, they're all within that fairly narrow age band of 3 to 3.5. On CELF Preschool-3, you can see we're showing the first 12 out of 21 items for expressive vocabulary. And so it goes a wider age range from 3 to 6'11". So the items start getting more difficult. And there's items such as, triangle and trunk and telescope. But that being said, at the same age for age 3, they only actually need to get 3 or 4 test items correct to be in a typically developing range. Here's an example of a test item where the content or approach are similar again. The examiner points to the girl on the left and says, this girl is playing, and then points to the girls on the right and says, she is, and the child fills in eating. And the next item is, tell me about this girl, she is, and the child says sleeping. So CELF Preschool-3 also tests progressive ing. It goes from ages 3.0 to 6.11. There's a lot of items. These are some of the easiest ones, and they test walking and sleeping. The major difference between the two tests is that, PLS goes on to test plural forms and answering where and when questions. There aren't 21 items following the same test format. Again, if you have a child who can stay put and is verbal enough to speak in sentences, then CELF Preschool-3 will give you a lot of depth of information. PLS will give you a few test items scattered across the age range. And in this particular case, both of them only have 2 test items looking at ing, present progressive, but then CELF Preschool goes on to look at quite a few others. And PLS also has additional morphology items, but it's handled in terms of, is there evidence that they're following a developmental trajectory, instead of looking in depth at, how much difficulty can they handle. Here's an example of the same kind of skill, but there are differences in the test format. So on the PLS, the buddy story is a much shorter story than the no juice story, and there are a lot fewer details that they need to be able to know to be able to get credit for this item. PLS-5, the scoring is very simple: introduction, sequence, and conclusion, unless you complete the language sample checklist. CELF Preschool-3, the scoring is much more detailed. There's several different aspects you're looking at as they retell the story, and clinicians can use either for a detailed language sample analysis, but in both cases, the children don't have to provide all the details for either story. So you have a same general kind of task available, but one is actually more structured to show how children would need to be able to understand details and make inferences and show some evidence of story grammar as you would need for a school setting, whereas PLS is really just looking at some basic information about, understanding a story and being able to give back general information. So on the 2 tests, if we look at them for a side-by-side comparison, PLS has 2 major subscales. So you get a score for auditory comprehension, expressive communication separately. Either one can be used to qualify a child for services, whether the child has either a primarily receptive disorder, a primarily expressive disorder, are total language that takes into account both. But the score on each subscale can be used for diagnosis. And then there are some supplemental measures that are criterion referenced. There's not a language analysis, there's not an item analysis, for example, for each age level, but across both of the subscales, the profile gives you an item analysis of how skills disperse are tested across ages. And so you can see from the profile that at the earliest stages, you're looking at very early communication skills on PLS, so pre-verbal skills, kind of move into vocabulary and concepts, and then a little bit later, morphosyntactic targets, and then those integrative language skills and pre-literacy. Self-preschool, instead of 2 scores and a total language score, you have your core language score would be similar to PLS's total language score. You have a receptive and expressive index, but then you also get norm scores for looking at language content, language structure, academic language readiness index, and an early literacy index. So a lot of detailed information, pulling information across different subtests to look at different patterns of scores. And then you have criterion scores for the connected speech sample, parts of the connected speech sample, and the pragmatics activities checklist. So on self-preschool, every subtest includes an item analysis. So sometimes it's a separate chart. Sometimes it's shown by the way the subtest is organized, that you're able to see at a glance what kind of skill the child might have particular problems with. So this is a side-by-side comparison of, just the numbers of scores. It is surprising sometimes when you look at, I think that'll come later, when you're looking at certain content domains, that there's a similar number of items for some of those domains on PLS-5 as there are on CELF Preschool-3, but they're scattered across several age levels versus having an entire subtest devoted to that. So PLS-5, you're able to look at items by developmental ages at a point where 80 to 90% of children are able to pass those test items. And sometimes this diverges from what you would see on older developmental checklists, where some of those checklists have been put together where 50% of children pass the items. So on PLS, that was purposely organized by 80 or 90% because clinicians were talking to parents about, at this age, in this age band, a child should be able to do all of these test items. And that's not necessarily the case. Usually the item at the very end of each age band, maybe 80% of children can pass, but there are still children in the normal range who may not pass that last test item. You also have your language sample checklist. You have a home communication questionnaire for kids functioning below age 3 that parents can complete before the child comes in for testing or can be administered as an interview. So here's just additional examples of the different kinds of analyses that you can do with CELF Preschool. When I was mentioning that sometimes there's not a separate item analysis, but the items are grouped into categories. So for example, on the pragmatics profile, the items themselves are actually grouped in a way that you're able to see where the child might break down, the child's skills might break down. So when we do a comparison of how PLS and CELF Preschool look at vocabulary, CELF Preschool looks at expressive items only, and there are 21 test items there. PLS has 20, I should have put whether it was numbered test items or individual sub-items, but there are 20 items across the auditory comprehension and expressive communication subscales, looking at vocabulary. But the PLS items on vocabulary stop at age 3. So, of course, if you're testing a 3-year-old, you won't be looking at vocabulary closely for PLS after that, whereas CELF Preschool the items span the age range of 3 to 6. So PLS focuses really on fairly early acquired vocabulary. CELF Preschool covers a wider range of topics for a little bit older children. And then after age 3, you know, the items transition right away then to concepts and morphosyntax targets. So these are examples of what the kind of information you get about vocabulary on PLS. So you can see that it's early developing vocabulary versus CELF Preschool, that after age 3, so items go all the way up to age 6, and that it's more difficult vocabulary. Although, as I pointed out earlier, if you're testing a child who's 3 on PLS, you have more items at that age level, but no vocabulary that gets any more difficult. On CELF Preschool, it starts from easy, starting at age 3, easy vocabulary, medium difficulty, and difficult vocabulary. For concept testing, you can take a look at the kinds of things that are tested. You can see on PLS-5 that it's very Head Start, kind of early developing vocabulary. So, and things that they were concerned about in a Head Start or developmental center, with colors primarily for qualitative concepts, easier vocabulary for spatial concepts, different kinds of quantitative concepts, and some of them involving numbers and counting, and time and sequence concepts versus same, different, and inclusion concepts are not included on PLS-5. In morphosyntax, you can take a look at CELF Preschool tests quite a few morphosyntax targets, and it depends on the subtest. So even on word structure, there are 24 expressive items looking at morphology. On recalling sentences, 15 items for sentences, versus PLS that has 8 morphology targets. And then the morphosyntax are in test items that look at making grammaticality judgments and correcting grammatical errors. And there are some items, 11 sub-items looking at different kinds of simple and expanded sentence structures. For pragmatics, most of the PLS items, again, are very early developing social communication kinds of skills and pre-verbal skills, versus CELF Preschool-3. That's very much about development of pragmatic skills that you would want to see in the classroom, but you would also see in the home. And they're all clustered in the 3 to 6 year age range. So this looks on CELF Preschool, you are looking at things like gaze and gesture and body language, but you're looking at those kinds of skills for children older than in that infant toddler age category. And in pre-literacy, on the left-hand side, you'll see the different kinds of skills that are tapped in PLS-5, again, to see if there's evidence of those skills emerging, rather than a really detailed list of kinds of skills that have been not just emerging, but acquired on CELF Preschool-3. So now I'm going to turn it over to Patricia who'll do this section on score differences.
Thank you, Nancy. I hope you can hear me. Turn my microphone on.
I can.
Okay. So at this time, we would like to discuss why you may find score differences if you choose to administer the PLS-5 and the CELF Preschool-3 to the same child. So we have some research that shows the relationship between PLS and CELF Preschool. This first study is of the relationship between PLS-5 and CELF Preschool-2, and this was conducted during the development of PLS-5. So the version of CELF Preschool that was available at that time was CELF Preschool-2. And this study was done on a sample of 97 children. The tests were administered in counterbalanced order. So that means that approximately half of the sample took PLS-5 first, and the other half of the sample took CELF Preschool-2 first, and the same examiner administered both tests in each case. In general, there was a 2 standard score point difference in PLS-5 auditory comprehension when compared to CELF Preschool-2 receptive language index scores, a 3 standard score point difference in the PLS-5 expressive communication scale and the CELF Preschool-2 expressive language index score, and a 2 standard score point difference in between the PLS-5 total language score and the CELF Preschool-2 core language score. So the scores for PLS-5 were slightly higher than CELF Preschool-2 scores. However, the results indicate that a child who performs poorly on PLS-5 is likely to score poorly on CELF Preschool-2. And more recently, a study of the relationship of the CELF Preschool-3 and PLS-5 was conducted. And this study was conducted on a sample of 70 children. The tests were also administered in counterbalanced order, so approximately half of the children took CELF Preschool-3 first, and then they were administered PLS-5, and the other half of the children took the PLS-5 first, and then they were administered CELF Preschool-3, and in each case, the same examiner administered both tests. Again, the children's PLS-5 composite scores were very similar to their CELF Preschool-3 composite scores. They were all within a 2-point difference. So if we compare the total language score of PLS-5, which was a 102 mean score, and the core language score in CELF Preschool-3, that score was a 103.2. Again, similarly, the auditory comprehension on PLS-5 was a 102.0, and the receptive language index score on CELF Preschool-3 was a 103.3, and the expressive communication on PLS-5 was a 101.7, and the expressive language index score on CELF Preschool-3 was a 102.0. So scores are very, very similar between both tests, and again, that indicates that a child who performs one way on the PLS-5 is likely to score very similarly on CELF Preschool-3. So we know that the population that we test as clinicians does not include many children who are typically developing, for the most part, unless you're involved more in the screening process. But for our referral populations, if we do encounter significant score differences among the 2 tests in a child who presents as having a language impairment, how do we explain that? Well, unlike typically developing children who have solid abilities and can perform tasks in multiple contexts, children who may have impairments are more sensitive to varying formats, contexts, and communication partners. And because this population may be delayed or disordered, the circumstances under which they demonstrate skills may vary. There are basic test differences when you compare the PLS-5 and the CELF Preschool-3. There are differences in the amount of cueing and prompting during each standardized administration, and the level of support is also different. Each test has a unique format for administration and scoring. Many tasks on PLS-5 are interactive, whereas most tasks on CELF Preschool-3 are structured. Some items on PLS-5 can be scored based on a previous observation or reports that a child does demonstrate a skill, whereas most items on CELF Preschool-3 have to be directly elicited in order to be scored. The layouts presented when eliciting responses are different, as you saw in the examples of the visuals used in each test. And the tasks also differ between more play-based tasks versus school-like tasks. And even the setups for using the same closed procedures or selecting items is different. In PLS-5, the context around that is more interactive and play-based, and in CELF Preschool-3, it's more structured. So this is a comparison of the formats between PLS-5 and CELF Preschool-3. Many items in PLS-5 require the use of manipulatives or simple picture stimuli. The tasks requirements change quite often from one item to the next because every item assesses a slightly different language skill. And there's also flexibility in how items are administered and when they are scored. So if you're familiar with PLS-5, if you observe a child use a pronoun or a verb, you can make a note of it and even score the item ahead of time so that when you come to it, you can skip it because it's already been scored. Also, most items on PLS-5 don't require a child to get every single attempt correct in order to score the item as correct. For example, an item that's assessing whether the child understands negatives in sentences only requires that the child correctly demonstrate an understanding of negatives in 2 out of 3 instances. So not every missed opportunity results in a score penalization. Some items can be scored, as I mentioned earlier, based on prior knowledge of what the child can do or a previous observation that showed that the child does have a skill. For example, an item in expressive communication that assesses whether the child combines 3 or 4 words in spontaneous speech. If you know of a phrase that the child has used or you observed one earlier and you made a note of it, you can score that item. So you're not expected to elicit a 3 or 4 word sentences from a 3 or 4 word sentence from the child in that moment. And for younger children, items can be scored based on caregiver report, observation, or elicitation. CELF Preschool-3 is also a child-friendly assessment. It's colorful, the visual stimuli is whimsical, but there are more structured tasks when comparing this test to PLS-5. The tasks require more sustained attention to complete a subtest. The demonstration and trial items are set up at the start of each subtest, and some subtests have up to 24 items. And for this test, all test item attempts are scored based on a child's direct elicited response. So even though there's data that shows that children score relatively the same on both tests, we still often hear from clinicians that PLS-5 is still viewed as being, quote, too easy, and CELF Preschool-2 is, quote, too difficult for children. If you're a clinician that feels that way, consider the population that you test. Does the majority of your client base have high vocabulary and frequent literacy experiences in the home, or does the majority have limited literacy experiences and school-like experiences? Does the majority of your client base come from ECI settings or special education settings, or is the majority of your client base referred from a general education setting or considered to be placed in a general education setting? Consider also each child individually and consider their age and their level of experiences. So not all 3-year-olds have the same experiences. Some come to the testing session with rich literacy experiences in the home, while others come to our test session and they've never been read to. Also, what is the child's communication and verbal skill level? Are the concerns global, or is there a specific language concern? What is the suspected level of impairment based on referral impressions? Does it sound like or look like the child is able to sit long enough to participate in a structured subtest that may ask 14 to 24 questions at a time? These are all factors that should be considered prior to selecting an appropriate assessment tool, but they can also be factors to account for when interpreting results from 2 tests that don't seem to match up perfectly. These are some of the questions to ask parents and teachers ahead of time. You want to know how the child communicates their basic wants and needs to get an idea of the child's levels of verbalizations. Are they nonverbal? Are they using one-word utterances or complete sentences? You want to know how the child's speaking skills are different from their siblings or peers, again, to get a sense of the level of delay as well as the main concerns. Obviously, if the child's verbal, you want to ask about their grammar skills and try to pinpoint what referral concerns are. If the child is in school, ask the teacher about their performance in language arts and reading tasks compared to their peers. You want to know if the child is an effective communicator with family members, teachers, and peers. This question can be used to identify the impact that this concern is having on the child's ability to communicate at school and in their community, and how socialization is impacted. There also may be concerns with social behaviors and pragmatic skills, and you want to know that ahead of time in order to select the most appropriate assessment tool. If you choose to administer an assessment because it's the one that's in your car trunk that day, or the one that is just so happens to be on the shelf at the elementary school where you're testing, that may seem convenient at the time, but you may waste time, because if it's not an appropriate tool for the child you're testing, you may not get what you need out of the results, and you may not get the scores that you expect. And that in turn is going to take more time, because you have to backtrack and look at all of these factors to explain these results. So it's important to have information about the child's history and their background and experiences, and also the level of language that they're using to communicate at that time. You want to know the questions that teachers and caregivers have, and also know what concerns you're going to need to address ahead of time so that you can select the right tool for the assessment. When deciding which test to use, always consider your referral questions, among other factors that we've discussed. But in very broad terms, if it's a question regarding early developing language skills and developmental milestones, PLS-5 may be the better option. If the referral questions are more centered around school and curriculum, like why is he not talking like his peers, or why is he not mastering grade level curriculum, then the CELF Preschool-3 may be the better option. You want to match the child's profile to a test that will enable you to administer the test in a standardized fashion. Either you can teach the task before administering a subtest, like you would in CELF Preschool-3, or you can select a tool that will allow you to back up to the skill level of the child so you can establish a basal. And so if you would need to do that, PLS-5 would be the better option. You also should be able to obtain sufficient information to inform a decision about the presence or absence of a language impairment. You don't just want to report on skills that the child has not mastered, but you want to get a complete profile. So you want to report information about the skills that the child has mastered and those that have not been developed yet. So you also want to be able to collect enough information to provide useful input to parents and teachers about how to support the child at home and at school, regardless of the diagnostic decision. Every child that you test, there are referral questions. Whether or not the child is diagnosed with a language impairment doesn't mean that those referral questions don't need to be answered. They always have to be answered. So you want to gather enough information to answer those referral questions and provide the information to the people seeking and that are making those referrals. Okay, so we're going to move on to look at some case studies. And this first study is a male, age 5 years, 11 months. He has no previous history of attending a daycare or preschool program. He does have a history of chronic ear infections. That is a risk factor for language delay. His kindergarten teacher reports that he needs maximum support in the classroom to participate in circle time and in small groups. So that's an indication that he has a difficult time with teacher or adult-led activities, right? Teachers and caregivers report that he mostly uses single words and phrases to communicate, and he's also difficult to understand. The referral questions are, does this child present with a language impairment, and would he benefit from special education support? So for a child 5 years, 11 months, items in the PLS for this age range are designed to assess semantic concepts, morphology, syntax, as well as integrative language skills and emergent literacy skills. However, this test is more appropriate for this child because he's most likely functioning at a much lower level compared to same age peers, and the PLS allows us to reverse in skill level until we can establish a basal in both areas of auditory comprehension and expressive vocabulary. So when we look at his scores on both scales, we find that he scored a 70 in auditory comprehension and a 67 in expressive communication. His scores are 2 standard deviations or more below mean scores. And when we compare the difference to determine if this child has a relative strength, the difference between his auditory comprehension score and his expressive communication score is 3 positive score points. The critical value for a child his age is 11 points. So the difference is not greater than or equal to the critical value. And that means that there's not a significant difference between his skills in receptive and expressive language. Both areas are considered equally developed, and both areas are significantly below age expectations. The prevalence for this kind of difference isn't rare. Almost 40% of those in the sample had differences of positive 3 score points between their auditory comprehension and expressive communication scores. Also, PLS-5, similar to CELF Preschool-3, has growth scale values. So that's shown in the table below the scaled scores, the standard scores. And these are based on raw scores. The growth scale values are based on raw scores. So you can obtain growth scale values to track progress if this child is given the PLS-5 during a reevaluation or his annual IEP. The growth scale values account for item difficulty. So if he has made progress in skills, it will be evident in the growth scale value comparison from one administration to the next. This is a visual found on the record form where the child's score is compared to most children his age in the sample. So that's the shaded region. And you can see from the plot points that he's significantly below age expectations. Because there were concerns with intelligibility, the articulation screener was performed and indicated that further evaluation was strongly indicated based on the number of sound errors he demonstrated and his age. Other supplemental measures used to support standard score results were the language sample checklist and the home communication questionnaire. Measures like this not only provide further evidence to support a decision for services, but they also help with developing goals and a treatment plan, and they serve to help make recommendations to the family in order to support the efforts at school. So now we'll move on to a second case study using the CELF Preschool-3 assessment process. And sequentially, what you can use CELF Preschool to do is first identify whether there's a language impairment, and then also describe the nature of the impairment. And then if there are referral questions regarding early classroom and literacy fundamentals or questions regarding communication and context, you can administer subtests to answer those referral questions as well. So this next case is based on a child who is 6 years, 1 month. She is starting first grade, and she's been previously diagnosed with a moderate to severe language disorder. She was diagnosed at 4 years, 4 months. So she's currently identified with a communication disorder and a specific learning disability. She received services from a special education teacher, the speech language pathologist, and an occupational therapist. So the referral questions are, does this child continue to present with a language impairment? And what kinds of supports and services does this child need to be successful in first grade? So first we want to look at the standard scores. CELF Preschool-3 record form summarizes the child's core language index and subtest scores. For this child, her core language score of 67 is in the very low developmental range and supports continued language therapy. She also has a receptive language index score of 79, which is within 1 to 1.5 standard deviations below average, so it falls in the mildly impaired range. Her expressive language index score is a 68 and is more than 2 standard deviations below the mean, so it falls in the very low or severely impaired range. And if we look further into the scores for the nature of the impairment, we can see that her language content score, which is a measure of semantic development, is a 78, and it is in the below average range. Her language structure index score, which is an overall measure of the ability to interpret and produce word and sentence structure, is a 69, and it's in the very low or severely impaired range. So here we have a pairwise comparison. This is located on the record form of the CELF Preschool-3. This compares the receptive language index and expressive language index scores, as well as compares the language content index score and the language structure index scores. When we compare these scores at the 0.10 significance level, we see that the difference between the receptive language index and the expressive language index is 11 points, and the critical value for her age is 10.14. So because the difference in scores is greater than the critical value, we can say that there is a significant difference between these scores. Although the difference is not rare, this kind of a difference occurs in less than or equal to 25% of the sample that was used for norming. Anything below 5% occurrence when compared to the sample is considered rare. The difference between language content index and language structure index was 9 points, which is less than the critical value listed for a child this age. So the difference between these scores is not significant at the 0.10 significance level. Based on those results, when describing the nature of the disorder, we can say that receptive language is a relative strength when compared to expressive language. Although the language content score is greater than the language structure score, it's not statistically significant. So language content and language structure are considered equally developed. Some additional information collected using CELF Preschool-3 that will help to answer referral questions are in the academic language readiness score. This score is in the below average range. And if we look at the subtests that comprise this index score, we see that her lowest subtest score was in expressive vocabulary. So it may be difficult for her to follow along in classroom discussions because she may not know the meanings of words used in the classroom. And this may help in collaborating to develop curricular modifications that would benefit this child, like maybe a recommendation could be that she could be provided with definitions to vocabulary words and key concepts used in classroom discussions. Also, the early literacy score was in the very low severe range. So she needs help with pre-literacy skills and phonological awareness. Reporting this information is critical because it seems to be consistent with how she's doing in the classroom. It may prompt some multidisciplinary collaboration between the speech-language pathologist and the reading specialist and or the special education teacher to increase phonological awareness and literacy skills. So all of this information should be interpreted and incorporated into her individualized plan. And this is a summary of the learning outcomes for today. If you have questions, please reach out to us using the emails that you have on your slide. And if you would like a comparison online, you can go to pearsonassessments.com, search for CELF Preschool-3, and select the resource tab to print out a flyer or see this flyer on which test is right for the youngest children on your caseload. Thank you for attending our presentation today. I hope you have a wonderful day.